Welcome back to the podcast Heal Without Harm. My name is Dr. Clayton Dir, physical therapist, the one bringing you the truth about the medical system, and today's topic is elbow pain. We can call it golfer's elbow, we can call it tennis elbow, we can call it medial epicondylitis, lateral epicondylitis. Pretty much, if your elbow hurts, this episode is for you. And if someone in your life has elbow pain, please send this to them. Just pause right now. Make sure you're driving safe. But send it to them and say, hey, I think this guy can fix your elbow. Or at least he can make it go faster, ultimately. The main things I see with elbow pain is people either have a very obvious, this is when it started, I did this, I did that, this happened, and it came on. Or I have no idea why it came on. It just started hurting one day. It wasn't that bad. And it's gradually progressed in the last 2, 4, 6, 8 weeks, whatever it may be. I will say some elbow pain can come on and go away all on its own, but if it's been persistent for probably 3 or 4 weeks or more, it's probably not going to go away on its own. And the first question I often get is, should I rest, should I ice, or should I heat? Questions along those lines. And what I have found as I read more and more literature and talk to other physical therapists in this field, along with just simply treating patients with elbow pain, is it never really gets better on its own with modalities like that, resting, icing, heating. If it's lasting more than that 3 or 4 week mark, you need to have strategic load placed upon that elbow. That is a fancy way of saying you need to exercise the elbow, but you need to make sure you do enough to tell the body to make it stronger, but not so much that you just make it super angry, ultimately. And this is what we call the Goldilocks zone. So as we get further into this, I'll make it make more sense, but it doesn't really matter if we're talking the inside or the outside of the elbow. Both of them have multiple muscles that somewhat blend together, become a tendon, and then attach to the bone. I will say most often I see lateral epicondylitis, so the outside of your elbow. That is where all of the muscles that extend your fingers, so straightening out your fingers, that's where all those come from. That's where the wrist extensors come from. And that is actually somewhat connected to grip strength, even though it's the opposite. It works together with the other muscles to ultimately grab your grip or to pick up stuff. Most of the time people have this pain anytime they do a wrist extension movement. They pick up something heavy. They pick up something with their wrist in extension. Trying to think what else. Usually pots and pans are painful. Picking up coffee mugs are painful. Kind of grabbing the top of a cup is painful when your fingers are kind of spread out as if your hand was a crane. All of those are usually the painful things that I hear for people. And then just the opposite on the inside of the elbow. But the one common thing that I usually see, actually multiple common things. First of all, the common things that I see with people is they come in and we always screen or look through their neck range of motion, their neck strength, and their shoulder range of motion, and their shoulder strength. And most of the time, I would say 50 to 75% of the time, the person coming in with elbow pain also has a neck and or a shoulder dysfunction. A weakness in the shoulder, a weakness in the neck, some sort of range of motion deficit, something like that, that usually changed when they have that deficit up the chain. It usually changes how they use that arm, and then it over time leads to an over demand on the elbow, and that is what actually kind of caused their pain to come on. So we still need to treat the elbow and make the pain go away there, but the reason that it's there, or the cause of the cause, is up the chain. It's up in the shoulder and it's up in the elbow. For you listening, if you have elbow pain or have had it in the past and it went away but did not stay away, this is usually the reason why. You essentially put out the fire at the elbow, but you did not put out the reason the fire is there, the shoulder or the elbow dysfunction. Sorry, the shoulder or the neck dysfunction. After we clear the shoulder, at least find some contributing factors there, then we go down and we check out the elbow and we start doing some range of motion testing down there, along with some strength testing, grip strength, and then just some simple manual muscle testing, where I'm essentially asking you to turn on the muscles and see which ones specifically are painful and part of the reason that you're having pain. From there, we usually ask, what do you do in daily life? Like, what does your life look like? Are you more sedentary? Are you more active? We establish goals and all that fun stuff. The usual PT type things. Most of the time, the muscles that are actively treated and worked on is the extensor carpi radialis longus, and then the extensor carpi radialis brevis, which it's a very long word, I know, but essentially extends muscles that attach to your hand. There's a long one and a short one. That's the fancy way. Usually we do that with something called dry needling. We'll do it with electrical stimulation, and we will also do it without. There's some other techniques that we can do where instead of treating the muscle belly, we can treat it where it attaches to the bone. But most treatments in just this all-encompassing thing, most treatments are going to come down to we are trying to create irritation and inflammation along the muscles, tendons, and where those attach to the bone so that the brain sends more blood flow and more healing properties to the area so that you can ultimately heal up this tissue. I say that because there are multiple times that I've seen people go and get surgery on the elbow and they usually didn't try physical therapy. In those surgeries, ultimately all they do is cut you open and like clip a chunk of bone out on the outside of that elbow so that it starts a big inflammatory response so that your body goes and heals up the area. And I think they're usually pretty successful, but they're quite invasive. And so if you haven't given physical therapy a really good try and found a good physical therapist, there may be a way for you to conservatively treat this thing without having to get surgery. On that note, though, a good physical therapist is also going to educate you on the fact that elbow pain can sometimes take 6 to 9 or even 6 to 12 months from start to finish. That is a long time. I completely acknowledge that, and that's what's frustrating. But usually in that time, you will see progression. It's just slow and steady, ultimately. So let's get into the homework that I would usually prescribe someone after assessment and then also treating it. Most of the time, the exercises, of course, are going to reflect all the deficits we found. If you have neck issues, we're going to give you stuff for that. If you have shoulder issues, we're going to give you stuff for that. But usually it's a combination of 3 things. 1, it's strengthening the external rotators of your shoulder. Those are the rotator cuff muscles primarily, and they are muscles that make your arm open up. So if you had your elbow bent to 90 degrees at your side and you took your hand and went outwards, that's external rotation. We're going to strengthen the muscles of the shoulder that do that. The second thing is usually some sort of range of motion improvement, such as stretching for the muscles that are irritated at the elbow. And lastly, this is the bread and butter. You have to do some sort of strengthening piece. So if we're still talking about the lateral elbow, the outside of the elbow, you have to strengthen those muscles. Strengthening those muscles usually look like doing wrist extension exercises. So think of a bicep curl, but just for your wrist extensors. So your forearm is supported on some sort of a table or even your thigh, and then your wrist and hand is hanging off the end, and you are taking a dumbbell and you are lifting it up, going into wrist extension, usually for 3 sets of 10. There's multiple different ways to do this. If that is too aggressive for you at the start, then we will do an eccentric version, meaning you use your other hand to lift the weight up, and then you take that hand away. So you remove the assistance and you let the hand slowly control the weight back down. You use your right hand again to lift it up, and then you slowly let it back down with no assistance from that other hand. Usually I start my people at 2 or 3 pounds, which sounds like really lightweight, I know, but it is wild how painful elbow pain can be and how much pain just 2 or 3 pounds can cause someone. Usually by the end, they're doing 8, 10, and 12 pounds, and the pain is down quite a bit. The other thing on this is you have to do a heavy enough load. So yes, we need you working through a little bit of pain, usually 3, 4, or 5 out of 10 pain, as long as it's not getting worse during the exercise, as long as the pain drops after you get done with the exercise, and any sort of soreness that we create with the exercise goes down or goes fully away within 24 hours. Because you are loading these muscles and strengthening quite a bit, you need proper time to recover those. So these exercises that I'm talking about are usually only given 3 times a week. Every other day is the usual cadence. So you work out the muscle, which you essentially cause micro damage to it through the exercises, and then you give your muscle 48 hours to go and heal that tissue up. That is the most straightforward exercise you can do for this. I keep saying the one thing. Another thing that is commonly missed by a lot of physical therapists, including myself until I discovered this, is the tricep. The tricep is a massive muscle. It's essentially the quad of your arm. This muscle is a huge, strong muscle, and it attaches primarily to the tip of your elbow. But if you look at like a muscle chart or an anatomy like chart or diagram, you will notice that it also attaches to the lateral elbow and it also attaches to the medial elbow. If you have someone in elbow pain and you start palpating around or poking around with your thumb into their tricep, you will usually find significant soreness or tenderness. This is another muscle, like I said with some of the shoulder muscles, if it is left untreated and unaddressed, you will either not get the elbow pain to go away, or if you get the elbow pain to go away, it will come back because you have not addressed all of the things leading to this elbow pain. So just to recap everything, 1, if you have elbow pain, we need to do a full assessment from neck down to hand to see, are there causes of the cause, or is this just elbow pain on its own? 2, we have to treat it. We have to ultimately tell the brain, hey, send some extra inflammatory mediators, send some extra love down to this area and heal this tissue up. That it usually looks like dry needling with or without electrical stimulation, some sort of scraping, Graston, gua sha, A-stem, some sort of like manual like scraping or working over of that muscle, and then maybe a little bit of cupping or some hands-on like massage type stuff, but something to intervene and tell the brain to heal this area up. 3, you need to exercise this muscle, but you need to exercise it very structured. You need to exercise it fairly strong, but with enough time to ultimately recover. Like I said, there's a Goldilocks zone. Not too much, not too little, but just right. You also need to be patient. This can sometimes take 6 to 12 months until full resolution, but most of the time I see these things getting turned around in a matter of 4 to 8, maybe 12 weeks at the high end if it's not one of those persistent ones. Those are the exercises that we usually see, making sure that we're addressing the shoulder and the tricep if needed. A little bit of stretching can be helpful, but usually is not that beneficial, at least in my experience, unless there is a massive deficit in range of motion of that elbow. This is your podcast over Elbow 101. If you have elbow pain, I hope this helps. If you need more specific questions, please check out the description, as I will have information there to contact me, or I can help you find a physical therapist near you if you are in the USA. Because apparently, after I saw my Spotify Wrapped, y'all listen from other countries other than the United States, which is super cool to me, and I appreciate your love and I appreciate your support. I hope that answers some questions. If you're somebody who's just simply supporting right now and you know somebody with elbow pain, send this sucker to them, because a lot of the times people will go on some sort of medication for a long term. They'll get injections that they don't need, or they'll get surgeries that they simply just don't need because they did not find a good enough physical therapist and they did not give it a good enough go, or they were not patient enough or not told to be patient through this process to continuously load these muscles and strengthen them up to what they must be. Thank you so much for your support. Thank you so much for your help. If you haven't yet, please subscribe to the show, as a lot of you, I think upwards of 50% who are listening are not subscribed. And it is really helpful on the back end to have you as a subscriber. And also, if you haven't, please leave a rating. Please leave a review. Not that many people go ahead and type in and leave a nice review. And those are super awesome. They make my day. And I really, really appreciate it. So I hope today this taught you a little bit more how to heal without harm. And like I said, send this over to a friend who's got some elbow pain. They would really appreciate it.